And so that's what I'd like to jump into now. I mean, we covered some of the basics of what colorectal cancer is, but early signs, symptoms, red flags, I'd really like to dive into that and start with what are the early warning signs for colorectal cancer?
Yeah. So I'm going to go back to a point I probably already just said, but I want to make it because it's so important, right? Like you don't have to have any signs to have colorectal cancer, right? And that's why we screen for it. And we'll talk more about screening. But the early signs, well, we talked about how colorectal cancer grows and develops. And it's essentially a growth, a polyp, and then this kind of mass within your colon. So the types of signs and symptoms are related to having that mass, that growth in your colon. So what are the kind of things that can happen? Well, tumor growths tend to have a lot of blood vessels. So bleeding is something that is a warning sign for colorectal cancer. You can have, bleeding kind of around your stool. You see blood in your toilet bowl. That's not normal. That's a definite warning sign. If that bleeding goes on for a long time, it could actually, you could start actually losing enough blood where you start having symptoms from that. So things like weakness, fatigue. Now, of course, things like weakness and fatigue are common symptoms. But again, I'm just putting it out there that the bleeding and then anemia, a low blood count, those are real warning signs that you could have colorectal cancer. I think the other things to think about are related to that mass in your colon. So that can have an impact on how you're feeling. Again, there's a lot of causes for abdominal pain. That's what makes this hard. But if colorectal cancer is getting very advanced, this feeling of fullness, feeling that maybe your appetite is not what it was, maybe you're starting to lose weight unexpectedly, those are warning signs. Like, let's face it, right? Like if you're unexpectedly losing 10 or 15 or 20 pounds, I mean, that's a time you definitely want to see your provider, whether it's colorectal cancer or some other form of cancer. It doesn't much matter. I mean, if you're losing weight unexpectedly, you want to see your provider. So those, I think, are the key warning signs: bleeding, anemia, weight loss, and then certainly abdominal pain could be part of it as well. But again, abdominal pain is such a common symptom. It's a little harder to frame that one.
It's in preparation for this podcast with you. One of the things that I found people searched a lot on Google and Bing and what have you was silent colon cancer, which now, as you're describing this, it's like, it's a lot of other stuff that could be, well, I didn't have coffee this morning and that's why I feel fatigued and this and that. But you're also not talking about a one-day thing. This is over a period of time that it's like, I'm constantly tired. I'm constantly fatigued. I'm not going to lose 20 pounds in one day.
That's right. Right. There is something about, right, some chronicity of the symptoms, but you say silent colon cancer, it's like really interesting, right? It is amplifying a message that I'm trying to give, that at least early on in the growth and development of colon cancer, it can grow silently inside your colon and you could be unaware of it. And so we really don't want people waiting for those symptoms of rectal bleeding and weight loss. But you're right. I mean, it's not like one day I have abdominal pain, I probably have colon cancer. There is some chronicity here and some constellation of these different symptoms that, right, make it more likely that you have colorectal cancer or some serious underlying disease.
So by the time a person notices that they have signs or symptoms, then it's progressed to a pretty serious point, if that is what it is, right? We're not saying that we don't want to cause mayhem, right. But
yeah, or maybe almost flipping it on its head. So if you would much rather be diagnosed with asymptomatic colon cancer that you found through screening than being diagnosed with symptomatic colorectal cancer. that being said,
For people that don't know the difference between asymptomatic and symptomatic, can you explain that real quick?
Right. Asymptomatic is at a time where you're having none of that. You feel perfectly well. You don't think you have disease. You don't think you have anything that really would make you want to do a colorectal cancer screening test. But again, that's exactly what we're recommending. Whereas symptomatic are the things we're talking about: rectal bleeding, weight loss, change in appetite. And so, but again, like flipping it on its head, much better, what the studies show, much better to be found through screening. You have a much higher likelihood of having early treatable cancer. But I also, if you have symptoms, don't wait, get evaluated. Colorectal cancer is a treatable cancer. I think we'll talk about some of the statistics. So if you have warning symptoms, it's not hopeless. You should see your provider and get evaluated. So best situation, you don't have symptoms. You think about getting testing, getting screening before you develop symptoms. If you have symptoms, see your provider, get tested. Don't avoid it, because we have good treatments for colorectal cancer, really at any stage, to be honest with you. But they're the most effective the earlier the stage of the cancer.
And so if I just went to the bathroom and I noticed I have blood in my stool, is it like, oh crap, I have colon cancer? Or it could be a number of things?
Yeah. Great question. Tough question, right?
Yeah.
Because the high level message, right, is we want people to get evaluated when they're having symptoms. But it would also be not right if I come and say, well, every person who has blood on the toilet tissue has colon cancer, because that's not honest and that's not fair. So yeah, are there other things that can cause rectal bleeding aside from colorectal cancer? And there are. Some are benign, like hemorrhoids, right? Hemorrhoids are just these blood vessels that are growing bigger right towards your bottom. Either they can be inside the rectum or just you can feel them on the outside. They can bleed. They can cause rectal bleeding. There's also diseases of the colon, and some people watching today might have some form of colitis, or they know someone who has something like ulcerative colitis or Crohn's disease. Those diseases can cause, some of the symptoms we're talking about: change in your bowel habit, rectal bleeding. I think the tricky part is thinking about, when is it okay to not immediately reach out, and when do you have to reach out? And I think if there's, I would have a very low threshold of reaching out to your provider if you're seeing blood in your stool, on the toilet paper on a regular basis. I think you need to get evaluated for it.
Yeah, I think that would be at the top of my list of things to do.
Yeah, exactly. Well, I do think, the reason I'm saying is because people, right, we all want to hope for the best maybe, and people do kind of move to this area. Well, I think it's just my hemorrhoids. And sometimes, I certainly know of cases where people go see a provider, and initially there's some kind of leaning into this idea. Yes, it's just your hemorrhoids. Well, if it is, then you should, someone should be taking a look, making a clear diagnosis. People should be trying something to get that symptom better. And if you continue to have the symptom, get evaluated, right? Get a colonoscopy. If you continue to have any type of bleeding, it's really important that you get evaluated. And so, yeah. So you asked the question, and I'll restate the question. You asked me, can it be anything else? It can be, but you really don't want to miss colorectal cancer. And your threshold for getting a provider involved, your threshold for getting a look into your colon has to be really low. Meaning, do it. Err on the side of getting evaluated, err on the side of getting checked.
And so this is something that you've kind of already spoke about, but it is very possible. In fact, it's very probable that someone is walking around right now with colorectal cancer and they have absolutely no clue. Like there is no red flag at all. They're just going about their business, living their life, feel great, just got done running a marathon.
Totally. I mean, maybe me, maybe you, although I mean, I can only speak for me. I'm up to date with colorectal cancer screening, but yes, I mean, it's certainly that is the most common way initially, right? It's sitting in your colon for a long period of time. So a key message here is, yeah, you know, if you're an adult listening to this podcast and you're between 45 and 75, even up to 85 or so, depending on, you know, your health, yeah, you're at risk. You could be harboring a colorectal cancer. And if you're not up to date with screening, you absolutely, positively should talk to your provider about getting screened for colorectal cancer. I mean, there's just a full stop. I guess maybe one way to emphasize it is we have organizations in this country, right? Like the U.S. Preventative Services Task Force that make recommendations for looking for colon cancer before people develop symptoms. Well, colorectal cancer screening gets a grade A recommendation, grade A. It gets a grade A recommendation. There are randomized trials, the best evidence out there supporting doing this, supporting looking for cancer, even colorectal cancer, even when you don't have symptoms. So absolutely, positively, what you said, just because you don't have symptoms at this moment doesn't mean that you don't need screening for colorectal cancer.
Yeah, it's not a virus. It's not the flu. It's not a contagious thing. It's like, it's legit.
Yeah, it's right. And as you're going down this path, if you have colorectal cancer, yeah, I mean, it's not going to resolve without you taking it on, tackling it, and getting treatment for it.
Yeah, no, I don't think ibuprofen is quite at that point yet.
Yeah, no.
You've got questions and we've got answers. Whether you served, are currently serving, are a caregiver, or a veteran advocate, the SITREP is your trusted source for information. Subscribe today at www.youtube.com/@VA Made Simple.